Hello, good day. I am Trina Maria Estigoy and I will discuss about what dental caries is, including its pathogenesis and etiologic factors. Dental caries is a biofilm-mediated, diet-modulated, complex, multifactorial, and non-communicable dynamic and microbial disease which is characterized by demineralization of the inorganic portion and destruction of the organic substance of the tooth. After brushing, a cell-free protein-rich layer called dental pellicle is formed on the enamel surface. Formation of dental caries will start when a bacteria with special receptors like MS species attaches to the formed pellicle on the tooth surface, resulting to a dental biofilm. Such MS species are S. sanguinis, mitis, oralis, and mutans. Microbial and mineral homeostasis occur when sugar is not available, having the dental biofilm's pH as neutral. But when a small amount of sugar, especially sucrose, is available, sugar will enter the dental biofilm, which serves as a food for acidogenic bacteria to metabolize and produce lactic acid as well as extracellular polysaccharide such as glucan. This extracellular polysaccharide will be the portal of easy attachment of more microorganisms as to dental biofilm. Ecological shift will then happen where pH in plaque becomes more acidic, leading to the proliferation of acidogenic bacteria which are capable of forming dental caries, and also aciduric bacteria which can grow with acidic environment. Because of these events, there will be a disturbance of microbial homeostasis where balance in the oral cavity will be at risk. If the minerals within the saliva will enter the plaque to attempt for neutralizing the acidic plaque, the minerals will react with the hydroxyl ions of the acidic to form hydrogen phosphate and water, which will help in cleansing the microbes that are present on the tooth. When there is no more sugar to be metabolized, pH of the biofilm becomes neutral again, restoring the microbial and mineral homeostasis. But if large amount of sugar is still present or intake of sugar is excessive, demineralization occurs. The sugar will definitely enter the biofilm again, forming lactic acid and extracellular polysaccharide, leading to another ecological shift, resulting to the disturbance of microbial homeostasis. In attempt of the saliva to neutralize the acidic plaque, sometimes it will not counteract anymore, resulting to more acids to be produced. Acidic condition is then prolonged. With this, disturbance in the mineral homeostasis happens where entry of more minerals to the biofilm will make the saliva more unsaturated compared to the minerals on the tooth surface. The hydroxyapatite crystals of enamel will dissolve, releasing calcium and phosphate, and will result in a subsurface lesion. This will be the initial sign of incipient caries. And to bring back the lost mineral content, remineralization must be done. This is where the sugar that is present will be removed and converts the remaining acid into salts, resulting to the rise of the pH. This will provide an outcome where mineral level in saliva is now higher than the mineral level in enamel. Because saliva has high level of minerals, reprecipitation of minerals in enamel then occurs. This is the process of remineralization. This allows the teeth to be normal again, but then again, if left untreated, and if remineralization did not happen, cavitation will occur eventually. Tooth, microorganism, and substrate. These are the three etiologic factors factors of dental caries. We will first discuss about the tooth as the host. If there is a variation in the morphology of the teeth, like presence of developmental defects in enamel or even a lack of enamel maturation, then probably the risk of caries increases. Caries risk will also increase if the composition is imbalanced in comparison to a sound tooth, most especially the fluoride content. Microbes may grow if there is an abnormal position of the tooth as it becomes difficult to clean and retains food and debris. These are the reasons why normal conditions of the tooth is important, as it will contribute to a healthier oral environment. With this, we can say that in order to prevent dental caries, tooth condition must be observed and examined first if a tooth has a proper morphology, composition, and position, and if there is a deviation, modification, or restoration of the tooth surface will be a big help in preventing further development of caries progression. Next etiologic factor is the substrate. Composition, quantity, pH, viscosity, and antibacterial factors of saliva must be attended, as this will determine if the saliva is able to perform a good oral clearance for the oral cavity. The substrate also involves the diet of a certain individual. Frequent intake of cariogenic carbohydrates will let the microbes adhere to the tooth surface, which greatly contribute to the formation of dental caries. In order to prevent the development of dental caries in connection with the substrates, as a dentist, one can discuss oral hygiene instruction to the patient together with key factors about dental caries to help them prevent the onset of the disease. A dentist can also include dietary instructions for the patients, especially to those who frequently develop dental caries because of food intake. These preventive factors will probably contribute to a good clearance by the saliva, thus promoting the healthy oral environment. Last factor is the microorganisms. There are two main important microbes that must be given attention. First is the Streptococcus mutans, which helps in the initiation of the caries formation, and second, Lactobacillus acidophilus, which greatly contributes to the progression of the dental caries. Eradicating or preventing these bad bacteria to grow in the tooth surface is a major concern, as this appears to be the primary organisms which is associated with caries in man. And to prevent this event, since these bacteria are vigorously stimulated by sucrose, limiting the substrate is of main concern, together with the stimulation of the salivary flow and the modification of the microflora. That would be all. Thank you.